And thank you very much for being here with us at the White House for a very important announcement, something we've worked extremely hard on. Today, the Department of Health and Human Services is awarding $1.8 billion in new grant money to fight the opioid epidemic, something we've had quite a bit of success on, and we're continuing, and I think you'll be amazed at the results. We've been doing this from pretty much the beginning, but really emphasis over the last year and a half. These funds will be delivered to the communities where the help is most needed. Joining us this afternoon is the Secretary of HHS, Alex Azar, Dr. Robert Redfield, Director of the Centers for Disease Control and Prevention, and some other of our friends in the room that have been so instrumental. We'll be introducing them in a little while. Thank you both for your devotion in particular to building a drug-free future for our nation. We're on our way. It sounds like a big statement, and it's a problem that every country is having, or most countries certainly, but it's something that I saw firsthand during the campaign, and I couldn't believe when I looked at certain states in particular how bad it was. We want a safe and healthy future for every American family. That's what I said we'd do, and that's what we're in the process of doing. I asked Secretary Azar to say a few words about the new funding. It's a record number. You add it all together, and people never thought they'd see a thing like this, but we're making tremendous headway, and I want to thank everybody with me today. And Secretary, if you could say a few words. Thank you. Thank you very much.
So thank you, Mr. President, for your dedication to this challenge. As you mentioned today, HHS is dispersing $1.8 billion in grants to help states and local communities combat our nation's crisis of opioid addiction and overdose. That includes $932 million in grants from the Substance Abuse and Mental Health Services Administration, led by Dr. Ellie McCants-Katz, to provide flexible funding for state governments to support prevention, treatment, and recovery services in ways that meet their state's needs. That can mean everything from expanding the use of medication-assisted treatment in criminal justice settings or in rural areas via telemedicine to youth-focused, community-based prevention efforts, recovery supports like employment coaching, and support for the distribution of naloxone. We're also releasing the first round of $900 million in grants from the Centers for Disease Control and Prevention, led by Dr. Robert Redfield. This money will help states and local communities track overdose data and develop strategies that save lives. Over the past 2 years, under President Trump's leadership, CDC has dramatically sped up its data reporting. When the president took office, overdose data nationally was only published with a 12-month lag. With the help of better reporting from local health departments, which we are now investing even further in, we've gotten that down to 6 months now. That's just one example of the results we've seen under this president. A year and a half ago, I joined him in Manchester, New Hampshire to launch his opioid initiative. He called for action, and that's what we've delivered. And I want to thank Kellyanne Conway, Jim Carroll, our drug czar, as well as my Assistant Secretary for Health, Admiral Brett Giroir, for their leadership of this whole-of-government effort. The president said we would, quote, prevent addiction by addressing the problem of over-prescribing. Since the president took office, the total amount of opioids prescribed is now down 31%. The president said we need to, quote, make medically assisted treatment more available and affordable. Our estimates suggest that in 2016, 921,000 Americans were receiving medication-assisted treatment, the gold standard for treating opioid addiction. In 2019, our estimates suggest we have 1.27 million Americans receiving this treatment, a 38% increase. The president said, quote, we're going to have to make sure our first responders have access to life-saving overdose-reversing drugs. Since he took office, naloxone prescriptions have risen 378%. When the president asked HHS to declare a public health emergency back in 2017, he promised that we'd see more approvals of waivers to help, quote, unlock treatment for people in need. They'd come very, very fast, he said, and since he took office, we've approved waivers for 21 states, compared with 4 under the prior administration. All of this work as the President explained, is making a difference and saving lives. I look forward to continuing the fight with President Trump, our team at HHS, and all of our partners at the state and local level. So thank you again, Mr. President, for your leadership of this critical public health initiative.
Thank you. Great job. Thank you. Edmund, would you like to say something? Please.
Well, thank you, Mr. President. We've combated this on so many fronts, and I'm privileged to be the Assistant Secretary working in your administration and also leading opioids policy for the Secretary. So much has been said, but I want to highlight one other piece of the equation. I'm a pediatric ICU doctor by training, and the attention that we have given to children who are born dependent on opioids and other drugs is really unprecedented and absolutely magnificent. We now have better forms of treatment for these children. We can keep them with their mother so they can both recover together. So across the board, we have treated this outbreak for what it is. It is a public health emergency. We are treating it as a public health emergency because it is. Addiction is a chronic disease of the brain. If you can hold your breath for 10 minutes, if I ask you to do so, that's like telling a person to stop using the substances they have a disorder for without appropriate treatment and guidance. So again, we continue to move forward, and although deaths are down 5% in 2018 compared to 2017, unprecedented, we all know that our battle is just starting. We need to keep all the money flowing. We need to insist on evidence-based practices so that patients and their families get the best possible treatment. And certainly everyone in this administration has the commitment to do that. Thank you, Mr. President.
Thank you very much. Thank you. Like to say something?
Thank you, Mr. President. Thank you. I lead the Substance Abuse and Mental Health Services Administration. I've been an addiction psychiatrist for 25 plus years, and I've watched this epidemic evolve. As a clinician, I feel very proud to be able to work in an administration with the President, with Secretary Azar, and with my colleagues that you see here, who all have such dedication to helping the American people with a deadly problem that we are making an improvement for in our communities, and we'll continue to do that until we get this epidemic under control and until all Americans can be free of opioid addiction.
Thank you very much. Go ahead. Leader. Thank you.
When I first spoke with the President about taking this position 18 months ago, we talked about the need to save American lives. And the President said, be relentless. And he was talking not only in saving lives from the drugs that are pouring into our country from overseas, but we talked about the need to help people who are suffering from an addiction. And I'll never forget that conversation because you were focused on the lives of everyday Americans throughout our country, in urban areas, through rural areas, and said, we bring a whole of government approach. And as you heard today, that is certainly the approach that Secretary Azar has done, Kellyanne Conway with getting the message out, with the First Lady talking about children. And so it's a great honor to be here and to represent, as I go around the country, the views of this President that the most paramount thing that we can do is save American lives. And we're doing that again yet today. Thank you, Mr. President.
Thank you very much. Great job. Thank you. You've done a great job. So we've all done a very good job, and I think numbers that nobody would have believed when we started, but there's a lot of dedication. I do want to thank Joe and Kellyanne and everybody for what you've done. I want to thank the First Lady. It's been very important to her. She saw it very early on. I think we can say, Kellyanne, and it was a very, very important thing. Just envisioning the tremendous problems within families caused by not only opioids, but drugs generally. It's a disaster. And it's, as I said before, it's all over the world. It's a problem all over the world. But we're hitting it very hard, and I think we're hitting it very effectively, more effectively than anybody would have thought possible. And we have some things happening and some things coming out. We're spending a great deal of money, at my request, on finding a painkiller that's not addictive, where people go out and they have a minor problem, they go to a hospital with a broken arm or a bad back, and they come out and they're drug addicted, and they have bigger problems than they ever thought possible. Literally, at the end of a week, their whole lives are messed up, destroyed. And we're setting rules and regulations that have had a tremendous impact. So I just want to thank all of you folks, Secretary, for the job you've done. It's really been incredible. The success has been great, but the real success will be, I think, over the next few years. I think we'll be doubling and tripling our numbers up. And if we do that, we're going to go from having a really big problem to having a much smaller problem. I guess there'll always be something out there, but it'll be a much, much more manageable, smaller problem. And we'll have saved a lot of lives and helped a lot of families, and will help people live a normal life as opposed to the kind of hell they're living through right now. So I appreciate you being here.